about all kinds of joints. Not the bad ones, though.
So roll the.
A movable joint is an articulation between bones in which no movement occurs.
For example,
Your teeth are connected to the cranium, and they're in the maxilla and the mandible, so they're like stuck in there.
But besides the point.
next up we're going to be talking about immovable joints.
Partially movable joints. You stupid girl.
Just kidding, partially movable joints. That is an articulation between the bones in which the motion is limited due to ligaments or cartilage. For example, the vertebrae in the spine, because they allow some movement, but mostly they support, so you don't want to go and dislocate 6 vertebrae.
Movable joints. Movable joints is the opposing surfaces are covered in a layer of hyaline cartilage or fibrocartilage in which some degree of free motion is possible. It's like your arm. So you can like
Die!
Most joints are mobile, allowing the bones to move.
Joints consist of cartilage, which is a tissue that covers the bone and stops them from rubbing and like grinding together. Muscles, tendons, and ligaments all affect the function of the joint because they all allow the joint to move. So your muscle is what makes your joint move the way it moves.
Okay, next up, we're going to be talking about synovial joints. They're also known as diathoracic joints. They join bones as bones. No, hinge joints. They're a common class of synovial joint that includes the ankle, the elbow, knee joint. Hinge joints are formed between 2 or more bones where the bones can only move along one axis to flex or extend.
Yeah, I'm Chuck West, and I'm getting really rich.
Pivot joint. A type of synovial joint. In pivot joints, the axis of a convex articular surface is parallel with the longitudinal axis of the bone.
Next up, we have the condyloid joint. An ovoid articulate surface or condyle that is received into an elliptical cavity. This permits movement in 2 planes, allowing flexion, extension, adduction, abduction, and circumduction.
Okay. A saddle joint is a synovial joint where one of the bones forming the joint is shaped like a saddle,
Like the saddle
with the
dome.
bone resting in it like a rider on a horse. So they're like this.
Next up we have a socket joint.
Socket joint.
A type of synovial joint in which the ball-shaped surface of one rounded bone fits into the cup-like depression of another bone. Like this. Joint stability refers to the resistance offered by various musculoskeletal tissues that surround a skeletal joint. It is believed that one or more of the subsystems must have failed if joint instability occurs, usually a torn or overstretched ligament.
Okay, let's talk about proprioception. Proprioception, the word, comes from Latin proprius, meaning one's own, individual, and capio capere, to take or grasp. Did I pronounce that right? Whatever. In the sense of the relative position of one's own parts of the body and strength of effort being employed in movement. And that's proprioception, sis.
Next up, we're going to be talking about the factors that can affect the range of motion of a joint. Extra fat or muscle mass may inhibit a joint's normal range of motion by physically blocking its path of movement. Body asymmetry. People who play asymmetrical sports like tennis, baseball, are likely to have less range of motion in the dominant shoulder or hip than the non-dominant side, although the dominant side may have more coordination, strength, and stability than the other side. Injury or diseases can cause the muscles in the injured site to contract reflexively to avoid further damage, thus limiting the joint's range of motion. Such conditions include arthritis, bursitis, bruises, dislocation, and sprains.
Joint movement. Okay. Joint movement. Flexion and extension. Are movements that take place within sagittal of the sagittal plane and involve anterior or posterior
Anterior, posterior,
movements of the body or limbs. Antagonist and agonist muscles often occur in pairs, called antagonist pairs. As one muscle contracts, the other relaxes. Also, sometimes during a joint action controlled by an agonist muscle, the antagonist will be slightly activated naturally. Synergist muscles
synergize,
or help perform the same set of a joint motion as the agonist. Synergists are muscles that facilitate the fixation action. Okay, that's all I got right now.
Next up, we're going to be speaking about the active resistant range of motion. The acronym for it is ARROM. The test is used to test strength for contractile tissues, muscles, tendons, and attachments. Or the therapist exerts pressure against the patient's contraction so that the patient prevents movement from occurring.
Passive range of motion, or PROM. Okay, passive range of motion, or PROM. Therapist or equipment moves the joints through the range of motion with no effort from the patient.
No effort.
An active range of motion, or an AROM, A-R-O-M.
Anti-chrome.
Patient performs the exercise to move the joint without any assistance to muscles surrounding the joint. 20 push-ups! Right now.
We found this video humorous, did you?
Nope. All those tabs that are open, that's what we have to read. Hey guys! Welcome back to part 2.
Now we're going to be talking about
Now we're going to be talking about evaluate. Okay, wait. The factors that contribute to the promotion and maintenance of a healthy musculoskeletal system.
low budget.
First off, we're going to be talking about the roles of the musculoskeletal system in achieving maintenance and wellness. Or no, maintaining wellness, sorry. Failure to maintain a healthy musculoskeletal system and joints can lead to a reduction in overall health and well-being. Physical activity is important for musculoskeletal health. It helps build and maintain healthy bones, muscles, and joints.
Wait, I'm not done.
A brisk walk every day enhances the bone mineral density and muscle strength.
Gotta make it brisk.
We're going to be talking about the basic effects of aging on the function of the musculoskeletal system. The effects of aging on the musculoskeletal fiber type and size. Aging has been associated with a loss of muscle mass that is referred to as sarcopenia.
Sarcopenia.
This decrease in muscle tissue begins around the age of 50 years old, but becomes more dramatic beyond the 60th year of life. Effects of aging on the musculoskeletal system. From about the age of 30, the density of bones begins to diminish in men and women. This loss of bone density accelerates in women after menopause. As a result, bones become more fragile and are likely to break. See osteoporosis, especially in old age.
And now we're going to predict the effect of lifestyle choices on the wellness of the musculoskeletal system, including choices related to cultural beliefs and practices. Musculoskeletal pain is any pain that affects the muscles, ligaments, tendons, and bones. Some of the most common conditions in this category include arthritis,
Fibromyalgia.
osteoporosis, musculoskeletal injury or overuse, and even disorders such as depression, anxiety, which can cause physical pain.
Yes.
Also, to maintain musculoskeletal health, we can 1, stay active. Put your fingers up. Thanks. 2, don't overuse your joints. Although being active is good for the joints. 3, eat smart. That means don't drink coffee every day.
Next, we are going to recommend preventative lifestyle choices required for the musculoskeletal system wellness, including describing the relationship of active living to musculoskeletal health, proper nutrition to musculoskeletal health, and proper lifting techniques and ergonomics to the musculoskeletal health. Okay, so active living to the musculoskeletal health. Together, bones, muscles, tendons, ligaments, and cartilage make up the structure and form of the body. They form the musculoskeletal system that holds us together, protects our internal organs, and serves as the machinery we use to move and carry out our daily activities. Our bones also serve as the storehouse for essential minerals. Our musculoskeletal system is made up of the parts of the body we can't see and pay little attention to until we feel pain. Our movement is restricted, or we can go no longer do the activities we enjoy.
We're going to talk about the proper nutrition to musculoskeletal health. You love this. Eating a balanced diet is vital for good health and well-being. Food provides our bodies with energy, protein, essential fats, vitamins, and minerals to live, grow, and function properly. We need a wide variety of different foods to provide the right amount of nutrients for good health.
And finally, we're going to be talking about the proper lifting techniques and ergonomics to musculoskeletal health. So, could you stand up and demonstrate my techniques for me, please?
Sure, sis.
So you have to bend down to the object, bending your knees. Okay, first you raise the object to be lifted upright. Put one knee against the object. Pull the object up the leg. Rest the object on the knee of the other leg. Stand up using your legs to lift the object, keeping your back straight. So you don't want to lift using your back like that. You want to use your legs like that. Next, you stand upright and carry the object with your back in an upright position. Carry the object as close to your body as possible.
Okay, so
Thanks for watching.
that's the end of our vlog.
Like, comment, and subscribe.
How sad it's over.
We'll see you next time.
We'll see you next time.